Where do you think the medical field should be going right now?
The medical field should be going in the direction of taking care of people in any way that works, and it's going to require a big change in the way the medical schools teach medicine to their students. It's going to require some backing off from the drug companies, which basically have the pocketbooks to dominate the whole direction of medical care. And it's taken me a long time to see that that's what's actually going on, but it's been going on for a really long time. It just happens to be occurring now more than ever. I mean, when I graduated from medical school long ago, I was given a doctor's bag. It was a leather doctor's bag by a drug company. I still have it. It's a great bag. It'll never wear out. But those kinds of things expanded into taking doctors on vacations to the West Indies and these kinds of things, and also giving them honoraria for lectures and sending them on trips to push the drugs that the drug companies are making. They even have things now that are being exposed in the medical journals of the drug companies actually doing the research and writing the paper and putting a well-known doctor's name on it with his approval and paying him for it. So now they got Dr. Jones's name saying this is a good drug, and they're selling it using Dr. Jones's name when he didn't even do the research or write the paper. So these are the kinds of things that are going on, which are being looked at, even by the Food and Drug Administration at this point. But the drug companies are very sharp. They know exactly what they're doing. They have brilliant marketing strategies that have been extremely effective. 10 of the wealthiest companies in the country right now are drug companies. They're way up there in income, and they know how to market their products, as we see on TV and in the magazines, and they have sidestepped, at least in the psychiatric drug sense, they've sidestepped the psychiatrist, which is only a small proportion of the total number of doctors in the pool, and they go directly to all the other practitioners. So they have gynecologists prescribing Prozac or some other antidepressant, or they have a general practitioner, or they have a pediatrician prescribing an ADHD drug to a child. What do they really know about that? Are they really qualified to do that? And how do they handle it in the future? And as we have talked about, putting a child on a drug, if it's a psychiatric type drug, sets the stage for him to remain on some drug with a similar kind of effect for the rest of his life, which is perfect for the pharmaceutical companies. Why would you give somebody something for 3 months when you can have them buy it for 35 years or 80 years or whatever?
So do you feel the first step should be in the schools, the universities, in changing the curriculum to really educate the doctors what they should be?
I would say, there's two ways to go about it. One, you go after the doctors and teach them, and the medical schools. Those are the people who deliver care. They really should know what they're delivering. And the other side is to go after the population, the people who are paying for medical care and receiving medical care. But actually, it would be a lot easier if it were being done right to go after the doctors, because they're supposed to be educators. And if they had the right things to educate people about, you wouldn't have to educate the population. You could educate the doctors, and they could educate the population, and you would have 500,000 doctor educators telling people, this is the right way to go. But we don't have that now. We have doctors looking at things in a certain way, and I'm not talking about all doctors. There are quite a few doctors who do understand nutrition, who use nutritional methods, who do understand that drugs are not great to be on for the rest of your life, and that things can be done in a different way. But it's not nearly enough, and the influence is excessive on the medical schools and on the teaching methods. So the population, a lot of people are on their own. Find out for yourself, look on the internet, read the right book, but then how do you educate yourself when you don't know medicine? So I have patients coming in saying, I'll never do that procedure, I'll never take a drug, I'll never have an operation, which to me in those situations is also not correct. There are times when you do need and should have an operation or a medication. But how do they get educated? Who's going to show them? I could give you, many, many, many examples, of the wrong thing being done. And, it's something that could be changed with a lot of work.
Would the proper term maybe be integrative medicine? Would it be the best thing to refer to?
Integrative works really well for me. You know, what I do not consider alternative at all. You know, I look at everything. I'm a board-certified internist. I work with drugs. I work with nutrition. I work with lifestyle changes. I refer patients for surgery. So integrative really is the right word. Medicine should be everything. It's not like, you know, everybody should be using herbs, or everybody should be doing this, or everybody should be doing that. It should be what's the right thing for that individual, and that should encompass everything that's available. Acupuncture 30, 40 years ago was looked down on as something that didn't work. You know, it's an Eastern philosophy. It doesn't, you know, really work. It's humbug. And now, in many parts of the United States, and if not most, acupuncture is an accepted method of treatment. Certainly in California, where I am, acupuncture is widespread, and it does work. Again, it requires expertise. You need to know what you're doing.
Thank you very much.